EMS agent as well as healthcare are really trying to do a lot, and you can help share that word. It is safe to call 911. It is safe to go to the hospital if you have a medical emergency out there, because we are seeing, unfortunately, a very sharp increase of people simply dying at home. I think that's about what I wanted to cover. If anybody has any questions.
Thank you. That's great information. Thank you for sharing that. And if we could all maybe try to get that message out as best as we can through our social media channels or whatever, that you can't ignore your symptoms. You need to get professional help. So that's really, really important. Julie, welcome. I'm glad you're here. We're going to circle back to you in a minute, but I want to get to Paul, because I know that care of Southeastern Michigan has probably been inundated with just all the things going on. And I know that you've been doing a lot of things, virtual meetings and things like that. So if you wouldn't mind filling us in on some of the stuff that you guys are dealing with, I'd appreciate it.
Yeah, absolutely. And those are a couple of tough acts to follow, you guys. It's, really the partnerships with, Henry Ford and just all the systems, Beaumont. Julie, we can't speak enough because of the, being able to work with everybody in that capacity. For us, the big shift did really start from within our ER programs, even prior to some of the shutdown, and just getting some, trickle down information from our partner sites saying, hey, some things they're seeing and trends with health. So we were able to kind of be a little proactive with our team, and kind of tried to stick it out within each site and work within the sites for the first, probably 4 or 5 days prior to shutdown, and then made the decision very quickly to pull everybody from our sites and, shift everything to an online format. Thankfully, we've got a really resilient team that really adapted well to stepping away from the in-person and, face-to-face contacts, and really shift to a phone and online, and really even jumped into training mode and be able to show a lot of the people in the community we serve how to do that themselves. So we were really fortunate with that. So we were able to just at this, right at the start around the 13th to really start our programming to provide trainings, groups, just really every social contact possible for individuals that at varying stages with their own recovery and their own supports, and not only just specific within the SUD side, but our prevention side and parenting side as well. So some of the info that, we sent out and the flyers that I sent to you, we were able to create those calendars really for just anyone affected by this. So it really helps family at large too, just to be able to have some things to talk about and walk through and deal with during this time. We were hit very early on, unfortunately, and I lost one of my team to COVID. He was unfortunately tested positive and diagnosed, and really within about the 2-week period had died. So that was very tough for our agency and team. And we also, right about the same time, lost a recent coworker that very similar, just exposure through working within the environment. So as an agency, we certainly had to come up with some ways to push through that and keep everybody motivated and certainly safe and sound. And so that's really always been our practice, to try and keep everybody in a spot where, safety first, and certainly moving forward. So we've really been able to create some great supports, and again, even with some of our partners within the health system that really kind of stepped in and helped us kind of really learn some new ways to support and push forward. So it's been really great to have that support as well. But overall, we've actually seen a really huge increase in a lot of our normal groups where, you know, sometimes there's a struggle to get people to come out at varying times. Now with the online capacity, as sick as we probably all get of Zoom and that FaceTime, we've actually had a really big increase for people, and been able to really convert just not only our recovery-based stuff, but just in our yoga, meditation, mindfulness, to really get individuals connected to some socialization. And through our community partners at DIA have developed some online art groups that really we're seeing have a big impact on for students and teachers. And so it's really been a great experience for us. So we continue to, you know, follow those guidelines and just add programming as it comes and the need and the request. We have continued to do our Narcan trainings online and continue to provide pickup once a week for individuals, you know, following our new protocols for individuals to come and do that. So through that program and through our mobile outreach, we're able to kind of reach the community and get them the resources they need during this as well.
People are certainly struggling in so many ways, you know, emotionally and mentally and physically and spiritually. And thank you for all the services that you're providing. And we did send an email out to the class. Paul was kind enough to send a bunch of resources. So if you haven't checked your email, you should have gotten that. So thank you for all the work you guys are doing. And I'm so sorry about the losses that that your organization experienced.
Sure.
That's tough.
Yeah, you know, unfortunately, I think we're all touched by it at some level, and certainly connect, you know, not just coworkers, friends, family. So we're, you know, that's been a help too, in the sense of, you know, knowing that we've all have that experience to share and, you know, cope through it. So.
Yeah, thank you. And the other part we wanted to touch on a little bit today was education, and that is another part that you know, I don't even know how people are doing it that have to work full time and then homeschool their kids, and I can't even imagine the stress that people are under. And I just, we have a lady that works for the MISD that's on our board, Alicia Fly, and she lost her mother to COVID a couple of weeks ago. And I talked to her, and she told me that since this started in March, that the MISD has provided over 1 million meals to kids in the Macomb County area, which is another thing you don't even think of. 1 million meals. It's crazy. But Lisa, I know you know, you're working at the MISD, and maybe you can kind of fill us in. Are you getting a lot of hate mail and hate calls from parents that are tired of homeschooling? And
I think every mom in the world now appreciates lunch moms. So the lunch service, I always wish that somebody would arrive at my home with lunch every day for my children. But thanks for letting me share, and thank you for mentioning Dr. Fly's mom. They were just the best of friends, and it broke our hearts at the ISD, and so thank you for mentioning that. But yeah, in the K-12 system, our first priority has been the safety and the well-being of our families in the county in responding to their basic needs. So as Karen mentioned, food sites just continue to crisscross our county. We deliver tens of thousands of meals daily, breakfast and lunch, to our community. And with that, you will see yellow buses all over the community still, not delivering children and not smiling children on the buses, but lots of food meals and educational staff that are helping to prepare and deliver those pieces. As Danelle had mentioned earlier, responding to community needs too. A few of you might have seen a couple video clips of Superintendent Mike DeVault and County Executive Mark Hackel, who led the charge in our schools to gather PPE equipment right away from our classrooms and science labs and health resources to deliver to the hospitals. At the same time, we've been preparing instructional staff to move to schooling, which is remotely being done in our homes. We worked with local districts to survey the needs of families, to secure and provide tech resources. And where possible, we do have a considerable amount of pockets in the county with either no Wi-Fi, where we're securing hotspots or additional devices, those type of things. For those that do not have access, we're providing packets, booklets, copies, and that's ongoing work from the ISD and from our local districts. To our youngest learners who are in the Great Starts Readiness program, we're delivering tens of thousands of books to them every couple weeks. Our teachers in the GSRP department and our early child department pick up those resources and deliver them to homes. And then of course, our instructional staff, they're helping each district with their remote learning plans. They're training teachers in the areas of technology and particularly trauma, dealing with trauma. We're providing distance learning opportunities. Of course, our schools are dealing with the preparation of graduation, which will be happening in most cases virtually. We've had several principals in the county hand delivering the different graduation gowns and congratulations and cords to every single home. And it's taking days and hours, but they want to make sure that those seniors are really recognized for their efforts of 13 years of schooling. So in addition, we're planning for summer opportunities, which will most likely happen remotely. We offer tons of summer camps across the county, which will most likely have to happen virtually. And then again, we're reflecting on these times and preparing for what will happen in the fall and looking at a bunch of different scenarios. But lastly, we're servicing the homeless population still. We're paying close attention to, Paul had mentioned, and to the mental health needs of our students and our staff and our families. And we're trying to lead with love, keeping in mind every day that we're in a crisis. So we're dealing with little resources, much like the other folks have mentioned. We have teachers that are teaching, you're used to a whole classroom of things and you're just teaching with whatever you have in your home, which can be a lot, it can be a little. We're obviously on the news, you've seen the last couple days, we're looking at potential considerable budget cuts to school, so we'll see how that plays out. But mostly we're dealing with family and staff that have been impacted, as you said, by job loss, social interaction loss, and sadly the loss of family and friends. And we're seeing those emotions being played out in the home and through our children. So it's a big thank you to everybody. In the education world, we call it educating the whole child. But really in this county, I would say that maybe we should change that to the whole child community education, because all of our community partners have really played a key role, including all of the parents in the county and the guardians, with establishing a little bit of stability for our children. And I did put in the resources, or in the chat there, that we do have an MISD community resource page. So anything that I've mentioned today that is available on that page.
Thank you, Lisa, and thanks for everything you're doing. I know it's got to be a really busy time for you guys as well. I appreciate you taking the time to give us a little recap. And Julie, since you weren't here earlier, I just wanted to give you an opportunity, if you had anything that you want to share about what you experienced as part of the Beaumont team during the last 9 weeks. Danelle and Chris talked a lot about what Henry Ford did and how it's a whole new way of practicing medicine. And I'm sure it's the same at Beaumont, but if there's anything you want to share, we'd certainly appreciate it.
Well, I have to apologize. This is my first Zoom meeting. My 14-year-old has been teaching my 7 and 9-year-old 3 days a week for me. So this is my first Zoom. So I'm sorry about earlier. But in terms of what's going on at Beaumont, it is very similar to Henry Ford. We initially, at the initial part of the lockdown, my team, the surgery PAs, were asked to transition into doing the curbside screening for COVID patients. and a tent was built outside of the main hospital structure, and we were in charge of determining whether patients should be swabbed or simply screened. And that was really difficult at first because, as you know, there was not much testing available at that time. And, you know, being that we are not necessarily PAs that do a lot of triaging, that was a bit of a challenge. And even IT was difficult because all of our accesses were based on surgery and nothing was based on more of the EC flow. So that was difficult, but my team took care of that for a few weeks. And then at one point in time, we were expecting to have over 1,000 COVID positive patients in our 500-bed hospital. And we had about 10 days to staff up for that. So we trained several of the surgery PAs to work with the medicine PAs and with the physicians and infectious disease and with nursing to do a team approach when it came to taking care of these patients on all the COVID floors. And it worked really well. Unfortunately, we never had our 1,000 patients. We never got that high, which was really great because that would have really extended out our resources beyond what we really had. We were rapidly trying to finish up a certain wing in the hospital. We were trying to get more headboards available for beds, looking at extending tents outside of our EC entrance. We were really preparing for the worst, but we never got there. So that was great. The other challenge I've had to face, unfortunately, is I'm sure it was in the media, was layoffs. And because we work in the surgery department, my team, we do a lot of orthopedic surgery, and orthopedic surgery was not necessary during this time. It was prohibited, and unless it was fracture care. And so we were forced into laying certain people off. I had to lay off 7 workers despite having them deployed to other units. So that was really difficult, especially since I've only been a manager for a couple of years. It was something unprecedented for us. So things are starting to get back to normal, though. We only have about 36 COVID positive patients at Tri-Beaumont right now. And we're starting to ramp up in terms of surgery. We're doing essential surgeries, fractures, infections, that type of thing. But then we're also starting to branch into patients that are in extreme pain and have had their surgery delayed. We're doing more colon cancer patients. We're doing some spine cases. We're starting to branch out, which has been really great. It's great for my team, and I hope eventually we can bring back our furloughed workers.
Thank you, Julie. We appreciate everything you're doing too. It's I know it's a lot. Everybody's life has changed so much. I want to be very respectful of your time, so we've got about 8 minutes left. If anyone has any questions for Julie or Danelle or Chris or Paul or Luke, does anyone have any questions or Lisa, any questions?
I have one for Luke, if you don't mind.
Mm-hmm.
Hey, you know, you're talking about the people that are scared to go to the hospital. I mean, is it a certain age group, certain demographic? Or is it just in general? Is it the older people that are scared to go to the hospital, the younger? What group are you kind of seeing most of?
So for emergency services, the tend to the elderly populations because of just their chronic health issues and their medical emergencies. We've not broken the data down that specific yet as to see, you know, all age groups. My guess is it's going to be fairly evenly spread across all age groups. Many of our younger patients and populations are taking the lead of their family. I would imagine it's probably spread across all age groups, but again, generally speaking, we see a lot of chronically ill older patients.
Any other questions?
I was wondering if you're seeing how the nursing homes are looking right now. And I know Amy don't you work in a facility, but you know, I just am curious if we have any idea of how the spread of COVID-19 is going in those parts of our population.
Luke, I can comment briefly. I monitor a database every day called EM Resource, and it is a database that collects from all healthcare staff in many different areas. And then I'm involved in several calls where we're kind of tracking the problem. Our long-term care facilities are still in a capacity. Most of them have COVID positive patients. Some of them have many COVID positive patients. It's gotten a little better as time has gone on. Many different agencies to healthcare facilities put into place good practices and processes. The PPE supply to our long-term care facilities has gotten better. Time simply and forced to discharge patients out to somewhere. And if they were a patient who needed long-term care, extended care, whether they used to be in that, going to that hospital, they were at complete capacity and had to put patients somewhere. That was just before we had the TCF Center in the city of Detroit open up. One of the that hospital was the types of patients they were taking. They were trying to avoid incredibly chronically ill patients and handle more just patients who were dealing with COVID now. So been a good reason these long-term care, it really wasn't utilized for that. And many of them went back to long-term care facilities or into long-term care facilities for the first time. Some more 1,000 patients currently who are COVID positive in long-term care, extended care facilities. So it is still an ongoing concern.
Elaborate a little bit, because we do, Cynthia, we have both assisted livings, but I also operate group homes for adults with disabilities. So I know both counties' Department of Mental Health have actually been calling the administrators. So I've been speaking to them fairly regularly. They're asking for counts on both our residents and our caregivers. So they've been doing a pretty good job in that aspect. We're still pretty shy in the PPE department. We don't have any COVID positive residents, thank God. But it sounds like it is, obviously still so scarce that unless you do have a COVID positive resident, they aren't distributing the PPE to us. I know that Oakland County has developed or has set aside a location at Pontiac General Hospital for our folks if they are COVID positive. So that's nice. So then you don't have to worry about, them being in contact with other residents in their home. The tricky part of that is a caregiver has to go with them. So they're not providing the care, they're providing a location where we can send someone with a COVID positive resident and quarantine there. So they're working on it.
Todd had a question about the antibodies, the antibody testing. Is it recommended and is it beneficial?
I can speak to that
a little bit. Oh, go ahead. Nope, go right ahead.
Oh, sorry. I was going to say we are doing a very large antibody testing at Beaumont Troy, and it's 2 tests separated 2 weeks apart, and they're using the ELISA test, which is used for HIV. And so that type of testing is usually very, very accurate. But we have also had practitioners where I work who have tested positive for antibodies at med centers and then tested negative with the more thorough test twice. So there's a lot of disparity between those 2 answers, obviously, and which one do you believe? And do you believe if a person tests negative, but yet they're still symptomatic? And, how long does a person stay symptomatic? I haven't found that testing patients, other than trying to decide for the in-house patients whether they should be in a COVID unit or not COVID unit, it just hasn't been very effective. Testing staff, testing patients that go home. Can you believe the test results is our biggest problem, the rapid tests.
Yeah, to speak a little bit to Julie's point, antibody testing, Henry Ford by the end of the month is going to start doing serological antibody testing on their employees as well. And I think the benefits are really yet to be seen. I think we're fortunate at this point in time that we are now in the data collection period of this crisis. So part of that is serological testing is going to give us a better indication on what we're dealing with and how long does immunity last. There was a question earlier as can people be reinfected, and I'm not sure that we know the answer to that yet. And those kind of testing and getting those out to the masses is where we're going to have that data collection point. So our epidemiologists can start to analyze that data to see, is this an immunity that wanes over time, similar to our flu or influenzas, or is this something that may have a longer term immunity? I think that's all still yet to be seen, and that's where the antibody testing will be beneficial.
Thank you.
I got one question, please, if you don't mind. So Beaumont has 46 positive, I believe you said. How many does Henry Ford have currently? If you can disclose that.
Yes, I can. I just have to pull up our latest stats. So we keep a running dashboard every day at Henry Ford, and I'm sure Beaumont does as well. So we know exactly who's in house every day. So currently we have 161 admitted patients with COVID and 370 that are in isolation right now.
Okay. Are they doing anything like now for the, you know, they're talking about the next round is going to be even worse. So from your aspect, what are y'all doing on your long range calendar to kind of get ahead of this instead of behind it like we did this last time?
I should add the Beaumont Troy has the 36 patients across the system. I know there are far more, but in terms of what we're doing to get ahead, we really didn't have a lot of struggle with PPE at Beaumont Troy. They early on developed sanitation for the masks with vaporized chemical sanitation and then UV light. So we always had PPE. That was never really a problem. But I think the biggest problem we had was with staffing. You know, these patients are sick, and they're sick for a long time. When they're on the ventilator almost at least 2 weeks, if not more. A lot of them are making it to the 3 and even 4 week range, and you need nurses and doctors that know how to care for these patients, and it's not a crash course that you can give in a short period of time. So in the short run, we are really working on ramping up our critical care staff, expecting that the fall may bring possibly an even worse outbreak than what we had this time.
To answer your question from a Henry Ford perspective, obviously we had a lot of lessons learned, and we have a lot of after action reports developed and plans that we can implement quickly. For instance, we converted our ORs into makeshift ICUs to help with the overflow. Like Julie mentioned, the high amount of volume of intubated patients that we had. You know, if you heard of the TCF center, you know, that was going to be up to 1,000-bed unit for overflow to decompress the hospitals. That was up in a matter of days. Fortunately, because of the measures from the community, we didn't end up really needing that kind of capacity. The highest amount of volume we had at that center was 19 or 20 patients. But if you've heard in the media, it's been shut down, but it hasn't been decommissioned. So we have overflow capability, all of the health systems in the area, to deal with an influx moving forward, as well as, you know, we fine-tuned supply chain needs so we don't run into those critical supply needs moving forward.
We have a suburban base care center that's open in Novi. They were set up for 200. They have 250 beds running. They're saying they are housing on average only 5 or 6 patients. Not becoming that facility yet, so we don't know how long that will be in place. And yeah, like she said, TCF is going to be. They're going to keep about half of those beds available for future.
Thank you.
Thank you, everyone. I know it's 4 o'clock. If you check your WhatsApp, I know there's been a couple of messages going around. I know Carl was mentioning something about internet access for students, so check your WhatsApp messages too. Did you find this beneficial? It's been a long time since we've seen each other, so it was certainly nice seeing you all. And I would love to do this again if there would be an interest. I don't want to be a burden on anyone, but if there's an interest, and if there's any particular speaker or topic that you'd like us to cover, I'd be happy to arrange that. So maybe in the next couple minutes, if we can just go around the room, and if you have anything to say, or if you have any suggestions for a future event, let me know. So Amy, I'll start with you, Amy Davis.
Well, it was good to see everybody, and I appreciate the updates from the healthcare workers and the frontline workers, and I definitely would love to do this again.
Okay. Paul? Oh, Paul, I can't hear. There you go.
Can you hear me?
Yes.
Okay, sorry. Yeah, no, I appreciate the opportunity to talk and expand on our service a little bit, but I thought it was really beneficial. Would love to do it again, and talk and see everybody.
Okay, thank you. Billy?
I would, I don't know. I really don't have a lot of time taking care of my bonsai plants and, my gardening and all of that good stuff. So, and I'm really tied up. Won't y'all see my bonsai? They're absolutely beautiful.
Oh, nice.
So, yeah, I would definitely love to do this without a doubt. So,
Okay.
and I not being from Michigan, I do say that Michigan has the best looking governor. So if we can get Miss Gretchen, I would definitely watch. So that's all I got to say.
Okay, all right. Nina?
Hi. I think, especially because this is evolving and changing, I think if we did this again, it would be great. And I think Alvin said this, but I was also thinking that, discussion on like economics and business and how that's evolving too, and kind of navigating that. But yeah, I think doing this again would be great.
Okay, thank you. Stacy?
I think this would be great to do again. I learned a lot. Even getting updates again from the front line, again from the healthcare, from Beaumont and from Henry Ford. My dad just came home yesterday from COVID, so he was at Henry Ford. He actually works at Henry Ford as well, so he was there for three weeks and a day. But he came home yesterday. He was on the vet and everything. So it's nice to hear that. It was nice to see that there's a lot of people going home too.
Great, thank you.
Yes.
Luke?
And yes, I enjoyed it very much. I miss this group very much. I look forward to when we can see each other again face to face. Also, but yeah, I think it was useful. I agree that healthcare updates are probably very useful for some people who aren't working in healthcare, but also, as mentioned, how is it impacting our business? Even another update on education would be useful. So yeah, so I would certainly like to do this again.
Okay, thank you. Lori, I know the county's been doing a lot of neat things too, so.
Oh yes, we have a lot going on, and just obviously being countywide, but more particular what I've been working on is a lot more of our businesses and trying to connect our businesses to PPE, trying to help them retool if they want to start making PPE stuff. We did one round of grant funding for small businesses. We are working to prepare another round of grant funding for businesses. So pretty much our day-to-day is just how do we keep our businesses' doors open, or how are they going to open? I did send a link in the chat on resources for businesses to reopen, some of the best practices based on industries. I could talk for a while, but and then just from another side of the county, our senior services has really stepped up to help all of our seniors. People have donated tons of food, and we created care packages for seniors. So most of them, we are still doing Meals on Wheels. They get their meals every day, but we also have done some care packages with some canned food, but also some like soaps and personal hygiene items, because they can't get to the store and do those things, and it's been very well appreciated. And a lot of people, like you said, like the hospitals have stepped up and donated. A lot of the hotels in the county have donated shampoos and soap for our seniors, and just the response is overwhelming.
Okay, thank you, Lori. Danelle, anything to add?
No, I would love to do this again. It was so great to see everybody. And, I know we did a healthcare update, but I think us in healthcare, like was mentioned, we want to hear what's going on in everybody else's world too. you know, we've been working a crazy amount of hours and don't get out much anymore. So yeah, we'd love to hear updates from everybody. I think it'd be so valuable.
Okay, thank you. Cynthia?
I definitely would want to do this again. I feel, you know, like a lot of us who are not in healthcare are able to really be at work. I feel very isolated at home. And so, you know, our news is pretty much our connection to what's happening in the front lines. So this was very informative. And just on a personal note, it was, you know, don't tell my boss this, but Leadership Macomb was kind of the highlight of my year, and I miss it more than I do my work. So it was really nice to be able to see you all again. I got a little teary-eyed thinking of our first session and, you know, meeting everybody, sitting next to Amy and learning about her and picking our colors. So things have changed.
Yeah, we miss you. We'll be together again soon. Bella?
Of course, I would love to do this again. It's great seeing everyone and just hearing, you know, the different perceptions, point of views, what's going on across the board. And definitely, I agree. It'd be nice to hear from the business side or, you know, different aspects going on. And I'm glad you are all seem healthy and well as of now. And hope you stay that way.
Darnell. I like the beard.
Yeah, this is called Quarantine Gray.
I know, I like it.
So everybody, just so you know, I dyed my beard this color just for the quarantine. It doesn't grow naturally. So it's gonna, I'm gonna let it grow out in a couple of weeks so it'll be black again, just for the record. No, I think we definitely should do it again. And thank you guys for the update. I really appreciate it. And I think it's just really beneficial and miss seeing everybody and hanging out and having a good time.
Thanks. Yuli?
No, I think everything's been said already. Definitely want to do this again.
Okay. Thanks. Nice seeing you.
Thanks. Too.
Lisa, anything to add?
No, I would absolutely love to meet. And I love the idea of maybe talking around how to revitalize Macomb, especially our small businesses, and how we can support getting people back up on their feet. So.
Thank you. Carl?
Yeah, I would appreciate an opportunity to be able to see everyone again. Yeah, definitely the world of online learning is at the center of the education world. So we're having fun trying to figure all of that out right now at the community college level, and with 3 boys at home and a teacher at home as well, trying to figure all that out. And the link that I shared, I would love to learn more about that as well. As I mentioned, having access to broadband is a major struggle, I think, for not just our students, but a lot of our families, just access to resources, basic access to resources right now. So increasing that access, I would love to learn more about that.
Yeah, okay, thank you. Jennifer?
Hi, everyone. I totally messed up on the time, so I literally just joined at 4, so I'm sorry to have missed the conversation, but maybe these topics were covered. It would be great. I mean, if we do this again, it would be great to hear what the status is on the census. I know that Macomb is performing quite well. Actually, most of Michigan is doing quite well, but I'm just curious how this situation is impacting the thinking of our really active census teams who had great plans for the year and this season. Also, I just find it so ironic, this keeps going through my head, that one of the last sessions that we had was with the health department, the county health department. And we were talking about like every disease except like a pandemic like this. And I'd just be curious to hear from that group, you know, kind of more of the inside baseball of how they've been tracking this disease and what the outlook looks like for our community as we hopefully approach recovery soon.
Okay, thank you, Jennifer. Luke, anything else to add?
No, not at this time. Again, I would very much like to get together again. Like somebody had mentioned, you know, maybe bringing in public health, emergency county. Wilbur would have been a great resource today if she'd been able to be here. So those would be some great, I think, resources for our next session.
Okay. Leith?
Well, definitely enjoyed it. Great seeing everybody again. Great getting the updates. I would definitely.
Thank you. Todd, I don't know if you can, I don't think Todd has a microphone. Chelsea? No Chelsea. Brian, anything to add?
Yes, I concur with what everyone else has said at this time, but yeah, I would say since healthcare is first and foremost on our minds right now, having an update, at least maybe not as, for the entire hour, but to at least have an update of where things are at the moment would be great, along with possibly what local government is doing, and also someone that could maybe do a forecast about the economy, what we can expect, over the next year as far as the local economy is concerned.
Great, thank you. And Alvin, last but not least. Alvin's not going to talk now. Okay. Well, Julie, how about you? I didn't get to you either.
I just really hope we can eventually go to the jail.
Oh, okay.
I was looking forward to that so much.
We'll do that.
And in the plane.
And the plane, yes.
And the plane.
Absolutely.
Me too, Julie. I want to go to jail.
I know, but this.
Alvin, are you there now?
Oh.
I'm here. I'm here.
Okay. You're funny.
Just for you, Karen, just for you.
Thank you. Thank you. You made my day. Anything you want to add? I guess not. No. Okay. Well, Julie Petkoff, anything you want to?
No, I took some notes and I'm going to send out an email with all these great links you guys have. And Karen's in charge, so she'll get all the big wigs to talk to you guys.
Well, it was great seeing everybody, and we will schedule something again soon. And